The South African doctor who first alerted authorities to the new Omicron variant says symptoms appear to be very mild, with fatigue one of the main complaints. The head of the South African Medical Association, Dr. Angelique Coetzee, says she became suspicious after several COVID patients presented with the same symptoms.
I then alerted my fellow committee members and said, listen, something is strange. All of a sudden, I have seen patients coming in today with very different symptoms. You know, fatigue is not really the prominent symptoms that we see with Delta. I suspect something is going on. I got a male patient, youngish, 30 years of age, coming in with severe tiredness and fatigue the past 2 days, with a bit of body aches and pains and a headache. But they were not very sick. None of them were extremely sick.
And Dr. Norman Swan from the RN Health Report and CoronaCast podcast says not much is known about the new strain.
We actually still don't really know. There's so much we don't know about this. So if you look at South Africa, rapid rise, particularly in the Gauteng province in South Africa, but elsewhere as well, from 0 to 90 or 100, even close to 100% of all genomes tested, but still relatively small numbers in terms of the genomes that have been tested so far. So it looks as if it's very contagious. It's got the mutations that make it look as if it's contagious. However, some geneticists are saying that it could have appeared, when they backtrack it, it could have appeared maybe in September. So it could have been around for 2 months. Now, if it's been around for 2 months and it's that transmissible, why haven't we seen it before now? There's lots of reasons why we might not have. So it's just not to jump to too many conclusions about its highly contagiousness, its degree of contagiousness at this stage. Does
it look more transmissible than Delta?
It certainly seems to have pushed Delta out the way in South Africa. So at the moment, on low numbers in isolated circumstances, it does look as if it's pushing Delta out of the way. But we've had false starts before.
What about severity of illness as a result of this new variant?
Again, we haven't got enough people who've been monitored with the illness to actually see that. There have been reports, one from Dr. Coetzee, who's the head of the South African Medical Association, who alerted the South African authorities to the condition, saying that her patients don't seem to be getting severe disease, but that's a small number of patients. You really only know when you see large numbers, and we still don't know in the elderly, and we're still not sure about the vaccinated.
And so does it appear to be the case that most of the patients out there, or most of the people who are catching it at this stage are younger people, and so it's hard to determine what the severity of illness is?
South Africa is a young country,
right,
and that's biasing the statistics. It's also a largely unvaccinated country. Only 24% of the population are vaccinated, and that it's just very hard to say at the moment. For tonight's 7:30, I've interviewed a professor of virology in South Africa who's actually just published a case study of a similar virus, a similar coronavirus, in this kind of lineage. So it's not this one, but it's similar. And he has shown in this one two things. One is that it is milder in terms of disease, but it also is vaccine resistant, but not completely vaccine resistant. The important thing to remember here is we're behaving a bit as though this is a new pandemic virus suddenly appearing. It's not. It's a version of the old virus. So it's quite likely that we've either got some residual resistance to it in terms of severe disease, and that the vaccines will still work in terms of severe disease. But what they won't work as well with is protecting against infection. Right. That's speculation.
And so taking all that into account, because the key factor here really is the vaccine resistance, isn't it? Because for a lot of the advanced countries anyway, who've got substantial portions of their populations vaccinated. So hopefully if this does emerge significantly, then it won't be as devastating as people thought it might be. Now, so just take us through the situation with vaccine resistance. You mentioned it there briefly.
They'll do laboratory tests over the next few days where they'll take the virus and expose it to antibodies from the blood of people who've recovered from COVID to see just how effectively antibody resistant it is, and by proxy that'll be how vaccine resistant it is. Then we'll see how it behaves in populations. It's not one size fits all globally. we've got very high levels of vaccination in Australia, and if it protects against severe disease, it's not really a huge worry for us, whereas it would be for a country like the UK or the United States or the European countries that are going through a serious Delta wave at the moment. So it's different for different countries. So last October, we were all vulnerable to Delta. This year, according to our vaccination status, but we do have to pay attention to boosters.
And what do you make of the Australian government, the federal government and state government action so far to keep this at bay?
Well, look, closing the borders last year had a huge benefit for Australia in terms of protecting us against outside infection. At this point, the virus is already in Australia, and all we can do by putting up the barriers again is just a delaying tactic to slow it down until you see just how this virus behaves. But it's not going to be sustainable in the long run, because the virus is around the world. And are we going to take that decision to stop Australians coming back home again? And the other problem is we haven't built purpose-built quarantine facilities, and in hotel quarantine you're going to put people in who are negative and who could come out positive because it's not purpose-built. In other words, hotel quarantine is not safe for people who are negative.
And so on the whole, at this stage, at this early stage, do you still have a significant degree of optimism that the world will be able to get on top of this new variant?
It doesn't matter what I think, but
but I mean, there's a lot of coverage of this at the moment. A lot of people are concerned about what could happen. But just looking at it calmly and rationally, what's your assessment of it?
I think for Australia, we'll probably be okay, and we'll just have to take a deep breath on it at some point quite soon, and once we know what the nature of the virus is. I think globally this is of concern because you've got vast swathes of the world who are not properly are not fully vaccinated, and that's huge. And we're paying the price for low to middle income countries not being vaccinated. And as Dr. Coetzee, the head of the South African Medical Association, said this morning on Radio National Breakfast, the world is not safe until South Africa is immunised, and that's a long way to go.
And you'll be covering this extensively on your podcast through the week?
Yep, if you haven't already subscribed to Coronacast, get in there. We'll be covering all this week.
Okay, thanks, Norman Swan.
You're welcome, Joe.